the first thing we have been asking for is to improve funding for health. Nigeria has been a signatory to the WHO charter that at least 15% of the annual budget should be should be allocated to health. And since that time, Nigeria has always been sub 5%. In fact, last year was less than 5% for consumption. And we are also advocating, asking for the universal applicability of the National Health Insurance Scheme so that we can have comprehensive. And apart from that, we are also discussing about some distortion in the hierarchical situation in the health system.
What are the distortions?
Well, I know that my friend who was here was talking about the position of doctors vis-a-vis the position of undergraduates. I don't know if I can just quickly go there and use it to highlight my point. Medical doctors pass through university for 6 years, 6 full years, not semester system. Semester system is 3 months, making 6 months, making a year. But a medical doctor does his own training January to December. So our 1 year is almost the same if you want to put it in semester system, 2 years. So if he's saying it's just 4 and 6 years, and he's thinking it's just 2 years, no, it's far more than that. And that is why when medical doctors are placed, they are placed because of the rigors of the intense nature of training. And pharmacists too, because they spend 5 years, semester system, they spend 5 years, while other enters at level 8, pharmacist enters at level 9. The same thing for the law graduates. So, if you're saying that doctors have been unduly put at an advantage position, no, it is because of what it entails. I agree. The situation is when a patient comes to the hospital, he actually comes for his treatment of his ailment. And the person in the center of this treatment is the medical doctor. And when the medical doctors decide to do this, call other paramedical officers to support, they come and do the support.
Okay. Why you call them paramedics?
Paramedics are people who are support staff of the medical practitioners. They are every other professionals apart from the medical doctors. Because the history of medical practice is that the doctors do all things. It's the doctor who now decides that he wants to do the laboratory section.
Is that still the case today?
That was how it started.
Yeah, but is it the case today?
The case today is that some of them have gone through their own professional groups. But that does not still equate them to a position in a way that they will want now to start taking the position of the lead trainer.
I guess they're just left to say they're not in contention with leadership. They're not looking for popularity or position.
Yeah.
It's just that things should be done fairly.
Yes, nobody is. That's what I want to say. Nobody is stopping them from doing things fairly. But when they want to do things and they want to go beyond their bounds, let me make some explanation. Everywhere in the world, we have the doctor at the center and he calls other people to support. But in Nigeria, we have people now who are taking this position that they want to be consultants, as you have heard him say. Consultancy services are given to anybody irrespective of where you are. We have media consultants, we have consultants to any other profession. It is acceptable, but in medical parlance, in the hospital area, the consultants are the doctors. They are specialists who take care of the treatment because they are consultants, because we are talking about patients. A classical example was we have an orthopedic surgeon at Ibadan who did an operation, and the second day he came and said he wants to examine the wound. He was asking the nurse to come and open the place, and they said they have directive from their own consultant not to open it. So the person who has actually done an operation Some other consultant is giving you conflicting information. So by the time you have 2, 3, 4, 5 captains in a ship, we know that we are going for a medical
So, does this mean that a pharmacist or a physiotherapist cannot be a consultant?
They can be a consultant, but within the hospital, the medically qualified person is the only person that can be a consultant. But you can be a consultant. You can have your own physiotherapist consultant. Anybody can be a consultant, in as much as you have the requisite knowledge and requisite qualification. Okay, but within the hospital setting, the question is, if you are a consultant pharmacist, what work are you going to do? What added advantage are you going to have on that patient care? If you are a consultant nurse, what added work are you going to put in this issue of medical care of that particular patient? They are called consultants because you said this is a gynecologist. A gynecologist is different totally from a first-degree medical doctor who has not had those extra training about that part of medicine.
Well, listen, first of all, I want you to address the term paramedics. How is that term being used? I don't know, but I would think that to the layperson right now, when you talk of a paramedic, what comes to mind is not a pharmacist. Am I right or wrong on that?
Well, the core medical treatment, the core medical team is the nurse, is the medical doctor, the nurse. Some countries put pharmacy, most countries do not put pharmacy.
No, I'm not talking about the medical team. I do know.
What I'm saying is that
in many countries now, when you talk of paramedics, they're the first people that get on site in the case of an emergency. Am I right or wrong on that?
No, come again.
The people who get to site in the case of an emergency, say in an accident situation, in a disaster situation, the first set of people who you get there are the people who are called paramedics.
No. We have different levels of training. We have within those emergency areas, we have some doctors, you can call them paramedics. We have some technicians, those are paramedics. We have some technology scientists, those are paramedics. I have told you that in the core of medical treatment, the core are the nurses, the doctors. In some countries, pharmacists are regarded as paramedics. In other countries, pharmacists are regarded as part of the core.
What about in this country?
In this country, apart from the nurses, and unfortunately in Nigeria, we don't have a clear-cut definition of a lot of things. Because over a long time of period.
Similar to that, a lot of people think paramedics are those first aid responders.
No.
That's also
we can have some.
And those who are not trained in the medical field as doctors or pharmacists who are not in that mainstream, just offering fringe services. But they are up and out saying you cannot refer to them as paramedics.
You mean the pharmacist? Yeah, some countries accept them.
In Nigeria, they say you can refer to them as paramedics. And they have full training of medical training. They deal in drugs, they cook the drugs. They say, look, you can't refer to us as paramedics. And that's part of why this argument is going back and forth.
The truth about it is that nobody is contesting what they have had their training upon. What we are talking about is the center of the patient care. What is the best for the patient? He has said he has alluded a lot of things why there were strikes. He has said that doctors are perennially on strike. I want to
divert patients.
I want to take exception to that. If we have 10 doctors, let's assume we have one or two who show some antisocial duty. You cannot use that one to generalize.
He's not the first person to make the right.
Yes, we have pharmacists.
You have the governor of Edo State make the exact same
the
thing.
same governor of Edo State who came to our summit and said some unprintable things about doctors. You see, we have individuals who have different, I will not say bias, I will say it's biased experiences. You see, but I don't want to talk about that. There is no doctor who diverts patients to their private.
How can you say that for sure?
I can say it because when you are taking an average, if Jesus Christ can have 12 and we still have a Judas Iscariot, we still have some 1 or 2 people. But in Nigeria, doctors do not derive pleasure in that. And Nigerian Medical Association, as an association, last time that we went on strike was in 2001.
The question also will be, I mean, yes, doctors can determine things that have to do with patients. Why would you now try to determine things that have to do with other professions?
That's very good. The question we are talking about is that in every system, there is what we call relativity. You know where you should be placed against other people working in the place. Take example, this speaking of complex 10. In complex scale, complex 9 is when you put it on the same scale to grade level with grade level 10. Naturally, the civil service grade, you will skip grade level 11. And complex 10, that is 9 is grade level 10. Complex 10 is already at grade level 12. That has been taken care of by the complex table. Okay? So if we have someone, a grade level 12 officer, who has worked for 3 years and is getting promotion, he gets to grade level 13. Okay? But a person who is on complex 9, who has worked for the same 3 years, starting at grade level 10, and is keeping that complex 10, then is going straight to grade level 13. And what it means is that we have effectively skipped 2 grades. And if it were you or any of us, who you were having a grade level superior to someone, and you are moving at the same grade, and you don't see that you are on the same level, on the same grade level, when you have moved after your promotion, it shows that that is not fair.
Sorry, we're running out of time. I'm trying to squeeze in so many questions at the same time. The NMA take this matter to court at any time?
No, the NMA did not take the matter to court. The Johesu went to court. And the Johesu got some judgment from the National Industrial Court, which has given one discipline. And what the NMA is saying, since it's going to affect all of us in the medical profession, let it go round. And the government is sorry.
Let it go around.
Yeah, for the Congress and Congress too.
Is that what the judgment of the court was?
The judgment of the court was on Congress. And then NMA says, look, if we are on this level for level, we know where we sit, and we are moving 2 grades. It means that if you are doing it for one group of people, you should be able to do it for them.
But they think that, look, we've got the judgment.
Yeah.
If the NMA
is not saying don't give them. That's a misconception. NMA is not contesting not to give them.
What is the contention?
The contention is NMA believe that, well, that judgment has come, it's unfortunate, but if you have to do it...
Unfortunate for the judgments that came from the industrial court.
But we have said one thing, we can see we are on appeal. We are on appeal.
That was what I was going to.
So if there is an appeal...
So if you're on appeal, why don't you wait for the appeal to see it?
Nobody is talking about that one. Don't give them. Nobody is saying that. What NMA is saying is...
There are many of us, or many Nigerians who are out there and wondering, many patients who are wondering if you're having issues with proper job description.
I think so. I think we have a very big gap in everybody knows his or her own turn in medical profession. You go to the hospital, you see anybody wearing white, they would like to be addressed as a doctor. And that is where we have the problem. Yes, everybody wearing white likes to be addressed as a doctor. You have pharmacists who are now saying that they have farm D and they want to be addressed as a doctor. They introduce themselves to this and doctor.
Okay, pharmacist, doctor is a doctor.
They will now say they are farm D. They now say they want to start doing work right. They now say they want to see patients. We have so many complications that is coming. And I told you about the consultant now. He's saying you cannot see a patient.
Okay.
These are things that are...
Okay, we'll let it go here for today, but I imagine that this matters will pop up again. And then we'll hope to bring them back in and shed some more light on this matter. Dr. Francis FADUYILE, thank you for coming on this morning.
Thank you very much.
Well, that's it today. Well, thank you all for watching. I'm Chamberlain, you saw.
Well, thank you so much for being so close to my company and now.
And I'm now Tyree. Have yourself a very Merry Christmas.